Joining us now to talk about all this, Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
Let's start with this fact that COVID was in the U.S. probably in December of 2019. Does that surprise you?
Not really, but this is really strong evidence that in this study, a prospective study of about 1 million people, it's like a health prospective study, and they collect blood and save it. They studied 24,000, tested them for the antibodies against coronavirus. They found 9 had it in mid-December. Of the 9, 5 were in Illinois, of all places. These may be the earliest infected people. Remember, this pandemic started in Washington State and then New York City. But the first cases that we've identified, because this big, huge study I'm talking about is all over the United States, is in Illinois. I don't know if anyone remembers the Mexican flu. A few years back, about 10 years ago or so, whatever it was. Turned out that started in California. We never called it the California flu. It's really, it's fascinating. How did these people get it? They don't know yet. I think they're investigating now.
So the Delta variant is now officially a variant of concern by the CDC. What does that mean?
Well, what it means, so variant of concern has to meet certain criteria. It's got to be more transmissible. It's got to be maybe a more severe disease, affect younger people. So it hit all those check boxes, and the CDC has called it a variant of concern. It's a little bit of just, semantics here. The WHO called it a variant of concern on May 15th. So, it's a very serious thing. As I think Robin mentioned already, 10.3% of all the cases in the United States now are Delta. And what to add to that number, the number of cases of Delta in the United States is doubling every 10 days. Remember, this thing is exponential growth. It's very disturbing for people who are unvaccinated because the vaccines do work against it.
Also worth noting that people who have been hospitalized with COVID recently all have one thing in common, and what is that?
Not 100%. Nothing in medicine is 100%. But between 95 and 99% of all the hospitalized patients today are not vaccinated. And if you look at the ICU rates, they're highest in the states that have the low vaccine rates. States like Wyoming, Missouri, Arkansas, and Idaho. They have below 35% of the people are vaccinated in those states. And the ICUs are loaded with COVID patients that are very sick. The most common age group, 18 to 49.
Right. Time for a couple of questions here, starting with this. It was hard for elementary school kids to wear masks all day. Do you think they'll have to wear masks all day at school in the fall?
For the teachers, they're vaccinated, so the vaccinated teachers don't have to do it. For the children, they're not vaccinated. If they have not received a vaccine, they should continue to wear masks. It's tough, I know, but we'll within the next few months, the vaccine most likely will be approved for emergency use authorization in kids maybe as young as 6 months up to 11 years.
All right, next question. I'm a 61-year-old male and got my Pfizer vaccinations. About 10 days after my second dose, I developed a blistery rash that was diagnosed to be shingles. I found there have been many complaints of the Pfizer vaccine triggering shingles. What's your opinion on that?
Go get the Shingrix vaccine. After you get your COVID vaccine, go get the Shingrix vaccine. Shingrix is a vaccine. You take 2 doses 2 months apart. It will cut the rate of shingles infection significantly, and people should get it. But as far as this person is concerned, yes, there have been reports, but shingles is pretty common, actually. So, there's a little bit of cloudiness as to, is this associated or is this caused by the vaccine? The immunologic response to the vaccine, did it trigger the shingles? A lot, like this viewer says, this person has looked up, and it is reported. It is definitely reported. But we're not really, it's not that common,
All right.
From the vaccine.
All right, Dr. Murphy, thanks again for joining us. If you have a question for the doctor, post it on our Morning News Facebook page. We'll talk to him again tomorrow. Check the weather, Paul.